assisting him or for complications that may come up. So it's not a matter of learning the single procedure itself, but learning all you can do. At a rural hospital, you need to, though we don't keep people in a ventilator, you need to be able to manage vents. So when you're going to your ICU rotations, learn how to manage those vents, learn how to innovate. We don't have anesthesiologists, we have nurse anesthetists, and what that basically means is that when I'm in the C-section room as a surgeon, I'm also in charge of anesthesia. So if things are going wrong, the anesthetist is asking you for questions. So once again, like the anesthesiology rotation, make sure you understand what's going on with the gases, how you're putting people in, bringing them up, because you're the one in charge of the room. So you have to be able to scope all that. So we'll look at cases in a C-section where you've got the anesthetist asking questions, you're doing the C-section, there's a problem with baby she just took out. So you gotta get mom clothes, you gotta go take care of the baby. So you have to go on your neonatal rotation, be comfortable intubating babies, those types of things. Now, most of those things at a small hospital you're going to be shipping out, but you need to be able to stabilize it. So your residency training is what you make of it. In any residency program in this country, you can get this type of training. You just have to be willing to go out and look in for it. Now, certainly there are some training programs that are set up for rural medicine and C-sections. The training program that I went to in Fort Wayne was not set up to train family doctors to do C-sections. It wasn't a track. I found some obstetricians that were interested in it. I found a perinatalogist that was interested and worked with them, and now it's actually attracted that residency program now. So just taking that additional after you're there on call at night anyways, go to the surgeons, go to your obstetricians, get those extra deliveries. Same thing with vaginal deliveries. You need to be able to repair those 4th-degree lacerations. There is no backup. There's no one you can call in and say, hey, I don't know how to fix this. I've never done it before. There's no one else to come in. So sometimes you feel overwhelmed, life has you down. This is my son, and that's one of our, there he goes. So you need to learn to multitask. This is one for you nursing your twins. Lifestyle and rural medicine. Lifestyle can get kind of hectic. I'm in a solo practice, and there's going to be varying different degrees. I've basically been on call 24/7 for the last 7 years and everything, unless we get call coverage, but certainly you can have partners that covered it. The trouble you run into mainly in a situation with this is because we're in a small setting, the hospital can't support several surgeons or several obstetricians, so we tend to focus on the family doctors. Well, one family doctor